9 strange signs of diabetes every woman should never ignore. Many symptoms of type 1 and type 2 diabetes in women are similar to those in men. However, there are certain symptoms and complications unique to women. Did you know that one of the main reasons women miss the signs of diabetes is because these symptoms often disguise themselves as familiar ones? Today's video will help you recognize these unexpected yet critically important signs. The earlier you're diagnosed with diabetes, the better it is for your health. This is especially true for women, who may face more significant complications from diabetes. The most frightening thing isn't the disease itself but the lack of awareness about it. That's why identifying these signs early is crucial. Let's dive in. Number 1, vaginal yeast infections, the silent stalker of diabetes. Itchy down there? That could be the first sign diabetes is quietly wreaking havoc on your body. Vaginal yeast infections are not just a simple gynecological issue. Elevated blood sugar levels can unintentionally create the perfect environment for yeast, especially Candida albicans, to thrive. According to the CDC, women with diabetes are 3 times more likely to develop vaginal yeast infections compared to those without the condition. The symptoms can be persistent or frequently recur if blood sugar levels are not well managed. You might experience itching, burning sensations in the vaginal or vulvar area, along with thick, white, cottage cheese-like discharge. Some women also report discomfort or pain during urination or intercourse. What's alarming is that these symptoms often don't fully go away and tend to return, creating a dangerous cycle if not properly treated. But a yeast infection is more than just uncomfortable, it can escalate into widespread inflammation, affecting your urinary tract and overall health. A weakened immune system due to diabetes only makes matters worse, turning what might seem like a minor issue into a serious sign of imbalance in your body. So, what can you do to prevent this? Start by keeping your blood sugar levels under control through proper diet and medication. Maintain hygiene by cleaning the vaginal area with clean water and avoiding harsh soaps that can disrupt the natural pH balance. Opt for breathable underwear, change it regularly, and consider adding probiotics to your routine to help maintain a healthy vaginal microbiome. Lastly, don't hesitate to consult your doctor if you notice any unusual symptoms. Early intervention can make all the difference. Number 2, sexual dysfunction, the silent saboteur of diabetes. This is one of the less talked about yet highly prevalent impacts of diabetes in women. Elevated blood sugar levels can damage nerves and small blood vessels throughout the body, particularly in the pelvic region. This damage results in reduced blood flow and loss of sensation in intimate areas, 2 critical factors for a healthy sexual life. According to research from Harvard University, up to 43% of women with diabetes report issues such as decreased libido, difficulty achieving orgasm, or painful intercourse. The symptoms of sexual dysfunction don't just affect the body, they can take a significant emotional toll as well. A lack of confidence, feelings of frustration, or physical discomfort can create emotional distance in relationships, leaving women feeling isolated or misunderstood. Diabetes acts as a saboteur, harming your physical health while quietly infiltrating your intimate life, ultimately impacting the quality of your relationships. But this doesn't have to be a dead end. Regaining balance begins with managing your blood sugar levels effectively. This is the first and most critical step. Regular exercise can also help improve blood circulation, with activities like yoga or Kegel exercises specifically supporting pelvic health. If you're feeling anxious or struggling to communicate with your partner about this issue, don't hesitate to seek advice from a therapist or a specialist. Open dialogue and professional support can help you reclaim control and rebuild intimacy. Number 3, polycystic ovary syndrome, PCOS, the unwanted companion. PCOS and diabetes share a strong connection through one central factor, insulin resistance. Insulin is the hormone that helps regulate blood sugar levels, but when insulin resistance occurs, the body must produce more insulin to achieve the same effect. This leads to common PCOS symptoms such as irregular periods, excessive hair growth, and difficulty conceiving. Statistics show that 70% of women with PCOS also experience insulin resistance. This is the critical link tying the 2 conditions together. PCOS can turn daily life into a real challenge. Symptoms such as oily skin, acne, hair thinning, and uncontrolled weight gain can leave women feeling exhausted and self-conscious. Beyond these physical symptoms, PCOS often causes mental stress and even depression, particularly as women struggle with infertility or difficulties maintaining a healthy pregnancy. But the true danger doesn't stop there. PCOS significantly increases the risk of developing type 2 diabetes, cardiovascular disease, and even endometrial cancer if left unmanaged. What can you do? Adjusting your diet is a crucial first step. Focus on a low-sugar, low-carb, high-fiber diet to combat insulin resistance. Additionally, regular exercise, such as brisk walking or yoga, can help balance hormones and reduce stress. If you're having trouble managing PCOS or notice worsening symptoms, consult a specialist for guidance and appropriate treatment. Early intervention can help you take control of your health and well-being. Number 4. Urinary tract infections, the uninvited guest of diabetes. Have you ever experienced a burning sensation while urinating and brushed it off as a minor issue? For women with diabetes, urinary tract infections, UTIs, are far more than a small inconvenience. When blood sugar levels are high, excess glucose in the urine becomes a feast for bacteria, especially E. coli, allowing them to multiply and cause infections. Symptoms may include painful urination, cloudy urine, unpleasant odor, or even blood in the urine. UTIs don't just stop at the bladder, they can travel up to the kidneys, leading to lower back pain or high fever. While this sounds alarming, there's another way to view it. Recurrent UTIs in diabetic women act like a special warning system from the body, signaling that your blood sugar levels are dangerously high and need immediate attention. Each infection is your body's way of telling you that bacteria have found a favorable environment, and it's time to act, not only to address the symptoms but also to prevent future occurrences by managing your blood sugar levels. You can reduce the risk of UTIs by taking a few simple steps. Drink plenty of water to help flush out your urinary system, avoid holding in your urine to eliminate bacteria more quickly, and wear breathable cotton underwear to keep the genital area dry and clean. So, if UTIs are the warning system diabetes uses to communicate, have you ever wondered what other disruptions your body might endure when blood sugar levels exceed safe limits? What happens when this imbalance begins to disrupt even the most natural rhythms of your body? The answers might surprise you. Stay tuned for the next section. Number 5. Menstrual irregularities, the offbeat melody of diabetes. Have you noticed your menstrual cycle becoming irregular, or even disappearing without a clear reason? This could be a sign that diabetes is quietly disrupting the hormonal balance in your body. When blood sugar levels are uncontrolled, they affect the functions of insulin and estrogen, two crucial factors in maintaining a regular menstrual cycle. This can lead to irregular periods or even long-term absence of menstruation, known as amenorrhea. Women diagnosed with type 1 diabetes at a young age are at a significantly higher risk of amenorrhea, while those with type 2 diabetes often experience shorter cycles accompanied by uncomfortable symptoms such as severe cramping or heavier than normal bleeding. This imbalance also raises the risk of serious gynecological conditions like polycystic ovary syndrome, PCOS, or endometrial hyperplasia. But instead of worrying, try to look at this positively. Your menstrual cycle acts as a precise biological clock, signaling when something is amiss. Recognizing abnormalities provides an opportunity to take control early. Adjusting your diet and exercise routines to stabilize blood sugar levels can help restore balance to your cycle. To address this issue, consider steps such as increasing your intake of fiber-rich foods to reduce insulin resistance, adding natural hormone-balancing foods like flax seeds and avocados, or participating in activities like yoga to lower stress, a key contributor to hormonal imbalances. And now, let's pose a question. If diabetes can disrupt natural rhythms like the menstrual cycle, could it also have a greater impact when you're trying to create new life? The answer may surprise you. Stay tuned for the next section. Number 6. Increased risk of vaginal dryness, a reflection of hormonal health in diabetes. Have you ever felt discomfort due to dryness, especially during intimate moments? For women with diabetes, vaginal dryness is more than just a minor inconvenience. When blood sugar levels are uncontrolled, the body reduces its natural production of lubricating fluids in the intimate area due to impaired blood flow and nerve damage around this region. This results in feelings of dryness, itching, and even pain in daily activities or during intercourse. This condition can also take a toll emotionally. Many women feel self-conscious or lose confidence, leading to strain in their relationships. Another crucial aspect to note is that vaginal dryness caused by diabetes often comes with an increased risk of infections. When the vaginal environment becomes imbalanced, harmful bacteria can thrive. If you notice symptoms such as persistent itching, burning, or abnormal vaginal discharge, it's time to take immediate action to protect your intimate health. Try incorporating simple yet effective measures. Drink plenty of water to help your body maintain natural hydration, increase your intake of omega-3 rich foods like salmon and walnuts to enhance skin and mucous membrane elasticity, and consider using safe lubricants or specialized moisturizing gels as a temporary solution while you work on stabilizing your blood sugar levels. However, if this dryness is already causing discomfort, what might happen if this issue escalates and begins to affect your ability to achieve a greater dream? The answer might surprise you in the next section. Number 7. Difficulty conceiving, the major hurdle of diabetes. For women with diabetes, the ability to conceive naturally can be significantly impacted by the complex changes occurring within the body. Diabetes disrupts the production and balance of reproductive hormones such as estrogen and progesterone, two critical factors that determine ovulation and fertility. High blood sugar levels can also damage the uterine lining, making it less suitable for an embryo to implant. Research shows that women with diabetes have a 30% higher risk of miscarriage compared to those without the condition, making pregnancy not only more challenging but also fraught with risks. Another lesser-known aspect is diabetes' effect on egg quality. When the body becomes insulin-resistant, it leads to hormonal imbalances, causing egg follicles to develop irregularly or with poor quality. This is one of the primary reasons many women with diabetes face difficulties conceiving naturally. But not all hope is lost. By maintaining stable blood sugar levels and adopting a healthier lifestyle, your body can gradually regain the balance it needs. Incorporating antioxidant-rich foods like leafy greens, berries, and nuts can support egg health. Gentle exercises can improve blood circulation, enhancing regular ovulation. So, what happens if you do conceive while managing diabetes? Stay tuned, as the next section will explore the impact of diabetes on your motherhood journey, and how you can transform challenges into opportunities. Number 8. Pregnancy complications, the mountain of challenges diabetes brings. Pregnancy is a magical journey. But for women with diabetes, this journey can feel like a mountain of challenges to overcome. Uncontrolled blood sugar levels can lead to numerous dangerous complications during pregnancy, from preeclampsia and preterm birth to excessive fetal growth, macrosomia. These conditions increase medical risks for the mother and impact the baby's health. A particularly noteworthy risk is gestational diabetes. Women with pre-existing diabetes are far more likely to develop gestational diabetes, complicating blood sugar management throughout pregnancy. This directly affects fetal health and increases the likelihood of a cesarean delivery or birth injuries. Additionally, diabetes can make you more prone to infections during pregnancy. From urinary tract infections to chorioamnionitis, these complications raise the risk of preterm labor or health issues postpartum. For the baby, high maternal blood sugar levels can lead to conditions like neonatal jaundice, breathing difficulties, or even an increased likelihood of developing type 2 diabetes later in life. But remember, pregnancy with diabetes is not an impossibility. By maintaining stable blood sugar levels and closely collaborating with your healthcare team, you can ensure a safer pregnancy. Follow a nutrient-rich diet with plenty of fiber and protein to regulate blood sugar effectively. Regular health checkups and appropriate exercises under your doctor's guidance will also play a crucial role. So, what happens after childbirth, when your body enters one of its most significant phases of change? Will diabetes continue to affect your life? The next section holds answers that will leave you reflecting deeply. Number 9. Postmenopausal weight gain, your belly becomes the unlimited storage backed by diabetes. Have you noticed your waistline expanding after menopause, even though your diet and exercise routine haven't changed? This is a common issue faced by many women with diabetes. After menopause, the decline in estrogen and progesterone slows down metabolism, while diabetes makes it harder for the body to control blood sugar levels and leads to more fat accumulation, especially in the belly area. An important factor to note is the change in how the body processes insulin. When the body becomes insulin resistant, excess glucose isn't converted into energy but is stored as fat. This is why many postmenopausal women with diabetes feel like losing weight is an endless battle. Research shows that postmenopausal women with diabetes have a 32% higher rate of abdominal fat gain compared to those without the condition. Postmenopausal weight gain also increases the risk of developing serious health issues like cardiovascular disease, high blood pressure, and even cancer. But this is not an insurmountable obstacle. You can start by adjusting your diet with low-sugar, high-protein foods to stabilize blood sugar levels. Adding exercises like brisk walking, yoga, or Pilates not only helps burn calories but also reduces stress, a factor that makes weight gain harder to control.